Hi, Corinn. I'm Ken, and thank you so much for doing the show today. I really hope that it's going to help people understand, the human side of this condition more than just like a list of symptoms would,
Yeah.
which is what my past video on this was. So, if you wouldn't mind, just introduce yourself and tell us how you came to your diagnosis of ankylosing spondylitis.
Yeah. So I'm Corinn. I'm currently 26 years old. But when I was 17, I started experiencing some hip pain. I didn't think much of it at the time. I mentioned it to my doctors. Um, it was a new pain. And so they kind of brushed it off with, oh, maybe you pulled a muscle or something like that. Like we could send you to physical therapy, but you could just wait and see. And then it got better. And then throughout the next couple of years, I would have these periods where I'd have really bad hip pain that would be really debilitating, but then it would completely go away for maybe a month, a couple months. And so for the first few years after I started experiencing symptoms, I didn't really think a lot of it. Um, I think because it would come and go, I would sort of forget about it when it wasn't there. And then finally, when I was 22 ish years old, the period in between having the pain started to get smaller and smaller. And pretty soon, by the time I was 23, I was in pain most of the time. And that's when I really started pushing um, with doctors and saying, look, I think something is wrong. I brought this up before, but it's been 6 years at this point and it's continued. And I
Now,
think,
real quick,
mhm,
on the pain, you said it was
mhm,
mostly in your hip, so
mhm,
it's basically just been that same area for the entire time. Has it spread at all as time went
mhm.
on?
Yeah, I also have knee pain, ankle pain, feet pain. Those are for me primarily the issues. But I think a lot of people have knee pain. A lot of people, have pain in their feet. So I think it's really easy to sort of brush those things off
Sure.
and think, oh, everyone experiences this. Um, and it's definitely pain, but it's not super debilitating pain typically. Whereas the hip pain would be things like I would I remember being in college and laying on the floor of my dorm room and crying because I couldn't sit up and
Oh,
thinking,
geez.
wow, I wonder if everyone else has this problem. I think, though, the problem really was that because the pain would sort of come and go, and when it was gone, it was pretty much completely gone at that point. And so I was, going about a normal life. I was playing sports, doing activities, just being like a regular college student, a regular young person. And so it was really easy for me and my doctors to sort of, for a long time, just brush it off and think maybe I overdid something, maybe I pulled a muscle or stretched the wrong way. It could be a million different things.
So you had mentioned that there were periods of remission in
Hmm.
between, this awful pain in your hip. How long were those on average? Did you notice that it was like a regular cycle, like every, month, every 3 months, or was it more random as far as how long you'd be in remission before the pain came back?
Yeah, I think at the beginning, it would probably be every 3 to 4 months I'd have the pain, and the pain would only maybe last 2 or 3 days, um, which I think really doesn't seem very long. And then you'd have 3 to 4 months of being completely fine. And then as time went on, the amount of time in between pain got shorter. And then the amount of days I'd be experiencing the pain during a flare up would get longer. Pretty soon it was only 2 weeks in between the pain and then a week of pain.
Now, when you say a week of pain, is it like an undulating cycle of where it's like it's a 2 when you first get up, and then within an hour you're up to like a 7, and then maybe some time would go by, and then an hour later you're back down to like a 3? Was it up and down, or was it pretty much just a constant pain, like a constant 6 or something for that
Mhm.
week?
Yeah. So one of the things with ankylosing spondylitis that they ask you about actually in the diagnosing criteria is, and that's pretty typical, is that you'll have really bad pain when you wake up in the morning. The pain will be really bad, and then as you start, moving around and getting going, the pain does get a little bit better. And so if I'm out sort of walking and I'm not really overdoing it, the pain does get a lot better. And then if I sit or I sleep or I'm kind of in one position for a long time, it gets significantly worse.
How has this impacted your daily life? So you've gone to college. Were you able to finish
Mm-hmm.
school?
Yeah, I finished school. I think that in terms of daily life before getting diagnosed, it wasn't a huge difference because most of the time I would just sort of push through the pain, especially because I didn't really know what was going on. The things that I think can be the hardest to do are some of the really simple daily tasks, like cleaning can be difficult, sitting at a desk can be really difficult. And so I, especially after getting diagnosed, I think I've been a lot more conscious, even just when looking for jobs, looking for a job where I wouldn't have to sit the entire day or I'd be able to take little breaks and sort of stand up, trying to, figure out different ways to clean things in my apartment or find simpler ways to just do really everyday tasks that I think most people probably don't really think about.
How did you and your doctor or doctors finally arrive at this diagnosis? It's been going on for years, and
Mm-hmm.
uh, you and your doctors kind of said, well, it could be this, that, or the other, and it was really easy to downplay. But was there a moment, or was there an event that was like, that was the defining moment that was like, no, we can't ignore this anymore. This is definitely something else.
Yeah, so I think the interesting thing is, I think I had that moment, and I don't really think any of my doctors had that moment. So I definitely had a moment when I was 23 where I was like, this is enough. This has to stop. Like, we need to figure out what this is. This can't be normal. This has to be something that's wrong. And so I did a lot of research on my own. I went to see the doctor. Again, got told, it's probably a pulled muscle. And I think at that time at the doctor's, I was like, how could it be a pulled muscle? This has been 6 years. How? And I think I said something even like, if it is a pulled muscle, if I'm pulling the same muscle over and over for 6 years, something that still seems like a
Right.
problem.
That's
So I pushed really hard to just get x-rays done of my hips because at that point I was like, maybe something is broken. I don't know. Maybe something is not where it's supposed to be. I don't know what it could be. And then when I got the x-ray report back, actually a nurse called me to give the x-ray report back. She called and said, you have some arthritis in your hips, but that's completely normal as you age. And on the phone, I was like, is it normal for a 23-year-old? And the
yeah,
nurse
no,
the nurse
no.
immediately goes, "Oh my God, I didn't realize you were only 23." She's like, "Let me talk to the doctor and call you back."
Oh, wow.
Um, yeah. So I think for me, that was really one of the big moments where I was like, okay, something is clearly wrong, especially on an x ray. If you're seeing arthritis in a young person, I think usually that means there's some type of a problem. And so I asked my doctor about it. Again, my doctor said, this happens to some people. It's probably fine. We can send you to physical therapy. So I went to physical therapy, wasn't helpful. And then I got really lucky, especially, living in the US where my insurance didn't require me to have a referral to see a
Mm.
specialist. So I made an appointment at a rheumatologist by myself. I did a bunch of research, read about ankylosing spondylitis, and thought, wow, that kind of fits. Saw the rheumatologist. And then within 10 minutes of meeting the rheumatologist, she had looked at my records and said, I'm 99% sure you have ankylosing spondylitis. We just need to do some tests to confirm.
So what tests did they end up doing to confirm?
So I had a couple MRIs done of I think my SI joints or sacroiliac joints, along with my lower spine, just to see if there was any structural damage, because they always look for that with ankylosing spondylitis. But usually that doesn't happen until the disease is somewhat more advanced, so it can be hard to find. They also look for inflammation around your joints. I actually had both already.
Oh,
And then there's also a blood test for the HLA-B27 gene because most people with ankylosing spondylitis have the HLA-B27 gene.
this was very definitive once they,
Mm-hmm.
started following, going down this path. It was, they were able to confirm it
Mm-hmm.
really quickly. It sounds like.
Yeah, my rheumatologist said that I fit pretty much textbook criteria for having ankylosing spondylitis, which is sort of crazy when you think about it took me 6 years to get diagnosed with having, textbook symptoms and textbook
Right.
criteria. And so for people whose imaging doesn't really show anything, I can't imagine how much longer it could possibly take.
And I'm just curious, because I know I would have done this. Did you go back to your other doctor
I
and
did.
say, hey, by the way?
I went in, I told her I had seen a rheumatologist. I had tested positive for the HLA-B27 gene and we were waiting for MRI results. And she goes, okay, so it's probably ankylosing spondylitis. And I was like, yeah.
Yeah, that's what I've been trying to tell you.
Yeah.
Jeez. How is ankylosing spondylitis managed? What kind of medications do you take to manage the progression of the disease itself? And then what do you do for pain management?
I think there's a ton of ways you can manage ankylosing spondylitis. There's a ton of different medicine options depending on how serious your symptoms are, or if you have structural damage, and also just what you feel comfortable with. So they're over-the-counter painkillers, essentially, like high dose anti-inflammatory painkillers, and so a lot of people take those. I used to take them, but they're really hard on your stomach. There's also biologic medicines, which are typically injections or occasionally infusions, that are supposed to sort of suppress your immune system and the cells that are overactive in your immune system, since ankylosing spondylitis is technically an autoimmune disease.
And that brings me to something else that you had mentioned. You, not too long after the AS diagnosis, you were diagnosed with Crohn's as well.
I mean, the lucky thing, I guess, for me about that was that I had also been complaining about some stomach issues for a long time. Once I got the AS diagnosis, I think my doctors were like, wow, maybe we should take things seriously with this and get this checked out.
How I just I'm so sorry that you're going through
No,
this.
that's
It's
okay.
just, oh my gosh. You have the diagnosis. Could you talk a little bit about how this has affected your day-to-day life as far as the type of work you can look for? Because I know you graduated university, but are you still finding you're limited in your career options? And just as far as, recreational activities, having a social life, how has AS and Crohn's affected just your day-to-day existence?
I think with employment, living in the US, health insurance is a big issue. And so the medicines, the biologic medicines especially, are incredibly expensive. So finding insurance that is going to work with the medicines you take, along with finding a job that sort of is willing to work with if you need to go to the doctor, if you have a really bad flare up. So it is something that I do look at if I'm applying to jobs or going to job interviews. The day-to-day things, especially with friends, I think because people typically get diagnosed with ankylosing spondylitis when they are in their 20s, it can be really difficult. Especially, most of my friends don't really get it. They don't really understand living with a chronic illness, and so canceling plans or having to sort of adjust plans because certain activities might not be super easy on my body. So I've found something like bowling makes my hands hurt really badly, which is not something I would have thought about before. Finding activities that are still fun and still where you can still be active and stuff, but also being really cognizant about, the stress you're putting on your body, and also what's going to happen the day after, or whether or not you have to cancel because of a flare up. So I think it is really hard with social activities.
Have you noticed that since starting on the medications, has the periods of remission increased? Are you seeing any relief from the amount of pain you're in?
Yeah, it's definitely better. It's a lot better than it is without medication. I think one of the things that's difficult is it takes a long time to sort of figure out the best medication regimen for you. I'm still sort of working on that. I have a biologic that I feel that works well for me. I also take things like methotrexate and occasionally like a steroid like prednisone, although I do try to avoid things like that if possible. But I do feel overall better. But then I think you have sort of the double-edged sword with medicine where then it adds symptoms. Some of them might make me nauseous or give me headaches. And so then you sort of have this extra thing to deal
It's
with.
a trade-off, right? You're
Yeah.
evaluating, okay, I can take the medication and get relief from my main symptoms,
Mm-hmm.
but that doesn't mean that I'm just going to feel normal. It means that I'm, in some cases, trading it for other symptoms that are
Mm-hmm.
maybe not as unpleasant, but still not, a lot of fun to deal with. I think chronic pain patients always have to do that cost benefit
Mm-hmm.
analysis. What would you say to people who might be watching this and they might know somebody who has AS? What advice would you give to them as far as how to better relate to them and how to be a better friend and a better support for them?
I think one of the things that I tend to have people say to me, even people who really mean well, is that, oh, you're so young. Like, how could your body be this bad? How could your pain be this bad? And so I think that with especially chronic illnesses in young people, you have to sort of mentally separate the young person and the chronic illness thing, just because I am in my 20s, but at the same time, that doesn't mean I'm just like any other 20-year-old. I think that's a big thing. I also think sort of just keeping in mind that even if someone with ankylosing spondylitis doesn't look like they're in pain, there's like a decent chance they are in pain. I think some people really underestimate how bad the pain can be. Like if I say I'm having a flare up in my back or my hips or something hurts really badly, I think people are like, oh, just push through it, or oh, go for a walk, it'll be okay, do some yoga. I think
Do some yoga.
it's always yoga. So I think things
Excuse
like
me.
that.
Yeah.
I also think one of the things that I see a lot of people with different chronic illnesses and things like that complain about is if you find out that someone has a chronic illness, immediately giving sort of unsolicited medical advice is usually not so helpful. Especially, most of us have probably tried all of it already. I mean,
Right.
if it were as simple as taking a supplement or just like, using essential oils or yoga or something, I think most of us would probably be all right. So it's
Hmm.
clearly not such a simple fix.
What have you learned as far as communicating with physicians regarding your condition? Kind of looking back on everything you've been through, is there anything you would do differently? What would you advise people who think they might have ankylosing spondylitis? What would you advise them how to approach it with their doctors?
Yeah, I think the hard thing with the medical system in the US and probably other countries is that especially primary care doctors have they have a huge amount of patients, such a small amount of time with each person. And so if you just, quickly mention, oh, I'm having this pain or something, I think for them, of course, it is really easy to just sort of say like, oh, it's okay. So I think really advocating for yourself, especially if you feel like something legitimately is wrong or that something isn't normal. I think that it is a little bit awkward, but I think sometimes you sort of have to push and ask for specific things. So if you think you need an x-ray, if you have, done some research, I think it is okay to, I mean, maybe your doctor is going to be a little bit annoyed, but at the end of the day, I guess I would rather annoy a doctor just a little bit and know that they heard what I was saying.
Well, I want to thank you again for doing this. I hope that someone sees this and it's helpful for them dealing with their own ankylosing spondylitis or whatever other chronic condition that they might have. But thank you, because I know it's it can be scary to
Hmm.
share, to be vulnerable. So thank you, and I
Yeah.
appreciate you doing this. And
Yeah, no problem.
thanks for making the time to see me today.
Yeah, of course.